Your healthcare provider has ordered a medication that will be administered using a Curlin pump. This instructional video will help you administer your medication effectively, comfortably, and safely. To get started, remove your medication from the refrigerator at the time specified on your medication label. Never speed the warming process by heating or microwaving the medication. Select a clean work area. Once established, clean your hands thoroughly using antibacterial soap and warm water. If no soap and water is available, use an alcohol-based hand sanitizer. Follow by drying your hands with a clean towel. Gather your supplies and prepare your sash mat as instructed. Curlin pump, medication bag, IV tubing, flush syringes, alcohol wipes, and if necessary, sharps container and/or trash container. Inspect the medication bag. Check the label and verify. Correct name of patient and medication, volume, amount of medication, discard date of medication, amount of time needed to remove medication from refrigerator to warm to room temperature. Next, change the batteries as directed. Locate the battery door on the back of the pump. Open the door by sliding the gray bar right to the unlock position. Remove the battery door by pulling the door downward. Remove the used batteries and discard as instructed. Insert the new batteries one at a time, flat bottom side first. Replace the battery compartment door and lock by sliding the gray bar left to the lock position. Next, prepare your flush syringes. Prior to using syringes, push firmly on the thumb press with the tip cap still on, just until you feel the plunger move. Expel air and excess solution by twisting off the tip cap and pushing the plunger forward. Push out extra solution to the amount instructed by your nurse. Finally, replace the syringe cap, being careful not to touch the tip of the syringe with your hand. If you touch it, you will need to start over with a clean syringe. Set aside the syringes until you are ready to use it. Repeat this step for all flush syringes needed for dose. You are now ready to prepare your IV medication. Remove the IV tubing from its package. Twist off the breakaway tab located on the bottom of the yellow flow stop. Remove the tab from the medication bag. Then remove the cover from the spike of the tubing, being careful not to touch the end. Lastly, spike the bag by pushing and twisting the end of the tubing into the bag port. Make sure the spike reaches the medication and does not puncture the bag. You are now ready to connect the tubing to the pump. Open the door of the pump by lifting the latch on top of the pump. Pull the door up and all the way open. Remove the used tubing and dispose in a trash container as instructed by your nurse. Then, locate the blue and yellow arrows within the pump as a reference point. Insert the blue tubing guide pin into the opening by the blue arrow, placing your finger over the pin to hold it in place. Stretch the tubing over the top of the pump, aligning it into the tubing track. Insert the yellow flow stop where shown by the yellow arrow. Ensure the tubing is in front of the door hinge. There is a notched area on the door hinge for the tubing to exit the pump. Finally, close the door securely and snap the latch shut. You are now ready to prime your IV tubing. When priming the tubing, make sure the tubing is not connected to the patient. Turn the pump on by pressing the on-off key. You will hear a series of beeps while the pump does an internal check. The screen will now read Enter to Select, giving you the option to select Program or Biomed Setup. Using the up-down arrows, highlight Program, followed by pressing the Yes Enter key. The screen will now read Enter to Select, giving you the option to select Repeat RX or New Program. Using the up-down arrows, highlight Repeat RX, then press the Yes Enter key. Release any clamps on the IV tubing. Press and hold the prime bolus key. Fluid will be pumped through the tubing as long as this key is pressed. Continue this process until a small amount of fluid drips from the tubing. Lastly, when you stop priming, the screen will give you the option to select Press Prime to continue or Yes to exit. Press the Yes Enter key to exit. You are now ready to flush your IV line with saline. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. If order indicates a different scrub product, please follow physician orders for your line. Once cleaned, do not allow the needleless connector to touch anything. Remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector using a push and clockwise twisting motion until secured together. Open the clamp on your IV catheter and/or IV extension set if indicated. Flush your IV catheter using a push-pause method. Do not attempt to flush if resistance is met. Double check that all clamps are open, then call your nurse or pharmacist. Lastly, remove and discard the saline flush syringe in a trash container. You are now prepared to administer your medication. Press the No Change key. The pump will automatically review the selected program. Compare the pump program to the label on your medication bag. Scrub the needleless connector on your IV catheter for at least 15 seconds and allow to air dry. Remove the protective cap from the IV tubing. Attach the IV tubing firmly to the needleless connector on your IV catheter. Open all clamps on the tubing. The one closest to you will already be open from the previous flushing process. Press the Run Pause key to begin the infusion. You will know your infusion is running when the green light beside the Run Pause key is blinking. The infusion can be paused by pressing the Run Pause key. The yellow standby light blinks and the screen displays Enter to select, giving you the option to select Resume, Repeat RX, or New Program. Your pump will alarm if you do not restart it within a few minutes. To restart your infusion where you left off, use the up-down arrows to highlight Resume and press the Yes Enter key. When it is time to change the bag or you have been instructed to stop your infusion, silence the alarm by pressing the Run Pause key. Then, turn the pump off by pressing the On/Off key. Disconnect the IV tubing and discard all equipment as instructed. If the tubing is to be used again within 24 hours, cover the exposed IV tubing tip with a sterile cap provided. You are now ready to flush your IV line with saline again. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the saline flush syringe. Attach the saline flush syringe to the needleless connector on your IV catheter. Flush your IV catheter using a push-pause method. Close the clamp on your IV catheter and/or extension set unless you have been instructed to flush with heparin. Lastly, remove and discard the saline flush syringe in a trash container. This will conclude your IV medication administration unless heparin has been ordered. If ordered, you will need to flush your IV line with heparin. Scrub the needleless connector on your IV catheter with an alcohol wipe for at least 15 seconds and allow to air dry. Remove the protective cap from the heparin flush syringe. Attach the heparin flush syringe to the needleless connector on your IV catheter. Flush your IV catheter using a push-pause method. Close the clamp on your IV catheter and/or extension set if indicated. Lastly, remove and discard the heparin flush syringe in a trash container, thus concluding your IV medication administration. Here is a SASH procedure summary to ensure you are administering your IV medication effectively. Flush your IV with saline. Administer your medication as instructed by your nurse. Flush again with saline. Flush with heparin. With each administration of IV medication, you will get more comfortable with the supplies and the steps. For any questions or concerns you might have, please contact our highly trained specialty nurses or pharmacists who will help you understand the basics of home infusion therapy and will answer any questions.